we recommend against testing for amyloid in asymptomatic persons by whatever means to look for plaques. And that's because there's no treatments. And, right now there are trials looking at if removing plaque in persons without symptoms lowers the risk or prevents dementia, Alzheimer's disease. So stay tuned for those results. But I think in general, my recommendation right now would be to, until we learn more, until there's a potential pharmacologic treatment, to probably not, I wouldn't, if it were my family member, I'd say, don't bother at the moment. Now that may change in the next few years, and we'll see what happens with these other trials, but it's tough because people want all this information. But the bigger question is, what are we going to do with that information? How is it going to help? Potentially, how is it going to harm? Like your example, right? Is it going to motivate, your friend? Is it going to motivate somebody to make these other lifestyle changes, be more vigilant, and they'll be able to sort of mentally handle knowing that they have amyloid in the brain? Or is it going to make them just worry for the next 10 or 15 years? Because amyloid builds up 10, 15, 20 years before the onset of symptoms. And especially in older persons, it's incredibly common. So once you get to your mid-80s or so, it's about a coin flip that somebody's going to have amyloid in their brain, whether or not they have symptoms. So how meaningful is that or not?
Right.
So it's a tough question. There's ongoing studies about, knowing amyloid, does that make people nervous? Do they, what's their outcomes 3 months from now? Is there any increased suicidality, for example? It looks like, for most people, there is a bump in anxiety if they learn they have amyloid, which tends to diminish and kind of go away with time. But some people could be potentially very psychologically distressed or go through sort of unnecessary procedures, put themselves at risk for no reason. Others may use that information beneficially. And so how to do that is a ongoing study of question and not an easy one to answer.